शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय दीपज्योति नमोस्तुते।
A very good evening to one and all. It's immense pleasure to welcome you all today for the webinar session on behalf of Center of Resource Development for Educators. I, Mrs. Uma Mahesh, welcome you all to our 44th session of Tuesday webinars. It has been a ritual on behalf of CRDE, which was started in October 2021, that we have been having every fortnightly Tuesday webinars, wherein we have been having speakers throughout not only India as well as abroad. As Center of Resource Development implies that we have been able to provide resource to the educators, which is of great need today. Center of Resource Development for Educators is the initiative of educators Dr. Suresh Nair and Mrs. Deepa Desai. Dr. Suresh Nair, President of CRDE, is a state teacher awardee. He joined Vivek Vidyalaya and Junior College in the year 2006 after serving for KC College for about 18 years as a professor of physics. His visionary endeavor in the field of education paved the way to fetch him an array of accolades. He is a co-author of physics textbooks for junior colleges and MHT-CET for engineering entrance examinations. Mrs. Deepa Desai, Secretary of CRDE. Mrs. Deepa Desai has been in the field of education for more than 37 years and is a recipient of many awards for her work. She is a former principal of Arya Vidya Mandir, Juhu, as ICSC board, the founder principal of Mahapragya Public School, Kalba Devi, a CBSE school in South Mumbai, and former head of IES Manik Vidya Mandir. She is a woman of many talents. Her rich experience as an educationist also made her an innovative and knowledgeable trainer for the CBSE and Sri Kelwani Mandal's group of schools in Shirpur, Dhule. CRDE is a platform where teachers and educators are manured to excel and mentor the student community through local and international mentorship. CRDE offers opportunity to experiment and implement ideas, innovations, and collaboration to achieve performance and continuous professional excellence. CRDE is where confluence of like-minded individuals share and imbibe knowledge, experience through interaction, deliberation, and international exposure. And CRDE has recently started with teachers development programs which are held offline at different venues, whereby with the help of different resource persons. In the past, recently we had Dr. Ambujam Iyer also as a resource person. Thank you, ma'am. Today, we have a multifaceted personality again before us, Dr. 𝐂𝐡𝐢𝐥𝐝 Srivastawa, psychologist and counselor. She is an RCI registered CBSE recognized psychologist, counselor, and NCS registered career counselor, life member of Indian Science Congress, Community Psychology Association of India, Indian Academy of Health Psychology, CCL, and MAP. Dr. 𝐂𝐡𝐢𝐥𝐝 is an ex-faculty of Agarsen PC College, Varanasi. She has been a facilitator, a resource person, and telecounselor and a facilitator of CBSE. Dr. Kumar has conducted many workshops and sessions for teachers, students, and parents in schools and colleges on behalf of CBSE and independently with other companies as well. Dr. Kumar is a soft skill trainer and conducted many sessions in hospitals, management institute, corporates, and banks training centers. She has attended conferences and seminars, presented papers published in journals. Dr. Kumar delivered talk in international conference on community psychology of OP Jindal Global University, Sonipat. She has been a mentor and counselor of 4 companies where she provides telecounseling, also counseling for students. Dr. Kumar organizes camps and does other social activities independently and also with NGO. Dr. Kumar Srivastawa is the founder of Wellness Center at Gomti Nagar, Lucknow, and provides counseling for all psychological issues to clients and all types of patients and clients. As I said, as she's a multifaceted personality because she's connected not only to the educational institutions, but also to different corporates and different social organizations. We welcome you, ma'am. Today, she will be presenting on protection of children from sexual offenses, which is called as POCSO, which is a dire need of today, especially for educators, parents, and students. Welcome you, ma'am. Over to you.
Good evening, everyone. It's my pleasure to be interacted with you all from Lucknow to Mumbai. And the topic is also very important and very close to me. As practicing psychologist, and I worked as counselor in many institutions in many states. So I have seen so many children suffered with these type of things. You people have also the same experience as working with children and school, college, and everywhere it is there. So I would like to share my screen and I would like to be interactive during the session. I don't like to be give lecture and all this. So just be interactive and if you people have any experience, so please share. Please share. It will be good for all. So let me try to share on my screen. We are not very much good in doing all these things. Okay, fine. I'll start with few pictures. Don't see the pictures, just feel them. Look at the eyes. Understand the age. As WHO has defined about the child abuse and child maltreatment, all forms of physical and emotional ill treatment, sexual abuse, neglect or negligent treatment, or commercial or other exploitation resulting in actual or potential harm to the child's health, survival, development, or dignity in the context of a relationship of responsibility, trust, or power. The definition is by WHO, and you can define in your terms, then also you will include all these concepts. So, child abuse, or you can say CSA, in which an adult or older adolescents abuse. Older adolescents are very much common nowadays. Abuse a child for sexual stimulation. Sexual abuse refers to the participation of a child in a sexual act aimed toward the physical gratification or the financial profit of the person committing the act. Forms of CSA include asking or pursuing a child to engage in a sexual activities, indecent exposures of genitals to a child, displaying pornography to a child, actual sexual contact with a child, physical contact with a child's genitals, viewing of the child's genitalia without physical contact, or using a child to protect child pornography, selling the sexual services of children may be viewed or treated as child abuse rather than simple incarnation. So we all have seen all these things surrounding us in the schools, in colleges, and in societies also. Although sexual abuse occurs across all income levels and racial, cultural, and ethnic groups, it is more commonly reported among families of lower socioeconomic status. Reasons can be many. Why lower social economic status children are more vulnerable? So there are so many reasons, not only the economic status. Children of all ages are victimized with the risk of sexual abuse increasing around age 10. And sometimes I faced or I deal with the children who have suffered all these things or the parents who discuss they are under age 10 also. Girls are significantly more likely to experience sexual abuse than boys. Very painful. So every child is saying that my body, my safety rules. Yes, definitely. My body, my safety rules are important. So let me discuss what is the meaning of child here and what type of abuse is described by WHO. Physical abuse, sexual abuse, emotional and psychological abuse, neglect. All four types of abuses comes under the child abuse. And I have some slides regarding physical illnesses or physical harm. I will discuss it later if the time is there because psychological issues are more important and more uh, close to my heart. So I would like to discuss about them also. And what is the POCSO Act and what is the role of school authorities and teachers. So I would like to take a break here, and I would like to invite you people. That what do you feel about these things? What is your experiences about all these things? Please share your views first, then we will go further. Uma ma'am, hello.
Yes, ma'am.
You people, please say a few words that I should come to know that you are there and you are.
Yes, I'm there.
So have you seen all these things in your schools, colleges, surrounding societies, colonies, even in the families also?
Yes.
Please share a few examples, then we can discuss the examples.
Okay. Like even in schools, when we have both the boys and the girls together, right? And we cannot tell them directly, don't touch, right? We have to say it in a very subtle manner. So that is why we need to have a special session for girls once they come to, at least when they come across their 11 years or 12 years, so that they understand how they are supposed to, whether understand whether anybody touches them and how they touch, so that they have an understanding. That's why we used to have sessions, such sessions for students as well. Yeah.
Yes. And we have seen all these things as showing bad pictures and stimulating them. Children of 10 years age or less than 10 years, or boys, and girls, boys, all this. But the more painful is when some family member is doing this child abuse. And sometimes parents, they don't agree, they don't accept that any family member is doing all these things. And sometimes child herself or himself is unable to understand that particular uncle, particular relative is doing something bad, Sometimes it happens. It happens many times. It happens. The person has started abusing a child, and child could understand after 1 year or after some time. Oh, that is not an injury, not an pain. It is a stain also, stain in brain or in mind, and it appears in adolescence ages and later ages. It reacts in many other way that we call any psychological disorders and something like this. So here comes a very important role as we are discussing with the educators or the teachers, and the topic was also related to the school teachers. So it is very important how school personalities or the authorities of school, maybe teachers or maybe non-teaching staff, what they can do with these child. The very first thing is to prevent, to protect, and if the incident occurs, then what they can do legally and socially, and the more important is emotional, right? So child abuse prevention programs in schools play a critical role in safeguarding the well-being of children and empowering both students and staff to recognize and respond to signs of abuse. These programs are integral to creating an environment where children feel safe, understood, and supported while also offering the tools necessary to prevent and address abusive behaviors early. By integrating child abuse prevention into the educational system, schools become key players in both identifying abuse and providing intervention before it escalates. So, teachers' capacity building, teachers or teachers' sensitization is very, very important. Rather, this is the responsibility of the school authorities. The very first is early identification and interventions. Schools provide a unique setting of observing children on a daily basis, making them on the most important environments for the early identification of abuse. Teachers, school counselors, and other staff members are often the first to notice changes in a child's behavior, sometimes before the parents also. Child's behavior, appearance, or emotional state that may indicate abuse. However, without proper training or the implementation of prevention programs, school personnel might overlook these red flags or fail to understand how to appropriately intervene. And you have seen all this, you had experience. कि Sometimes it happens, there is a very small issue occurred in the classroom, and the teachers who are not that much sensitized, they make a very big issue in the school, and all children and all these persons are get affected. So it is also very important to react in a proper way with empathy and not with sympathy. Empowering students through education. Yes, it is very much important. Adolescence education program. We run the adolescence education programs in schools, even in colleges also, to train the students. And nowadays, I add one thing more. Along with adolescence education program, adolescence education program, we include two type of things. One is the psychosocial changes, one is the physical changes. Now, I added one thing more, that is to teach students about their own boundaries. Boundaries are very, very important to make the child safe. The child can be very safe in his own boundary. So, as a teacher, we have the responsibility to teach them about their changes, the acceptance, the behavior pattern, as well as their boundaries, right? So, empowering students through education. Prevention programs also directly target students, providing age appropriate education on the concept of abuse, personal boundaries, and safe relationships. By teaching children to recognize inappropriate behavior and how to report it, these programs empower young people to advocate for their own safety. For younger children, prevention education often includes lessons on identifying trusted adults, understanding the concept of good touch and bad touch, and emphasizing that abuse is never the child's fault. For older students, the program can develop deeper into the topics like sexual harassment, digital safety, and the importance of consent in relationships. Providing this education equips students to protect themselves and others, reducing their vulnerability to victimization. And the children must be given some corner or some box in every school that they can write their problem and drop in a box without knowing to without telling their name also, so that school can come to know okay, what is happening in the premises. So, creating a safe and supportive school climate. Schools that implement child abuse prevention program actively foster a safe and supportive climate where students feel comfortable seeking help. A culture that prioritizes safety over silence encourages children to report abusive situations, knowing that their concerns will be taken seriously. Additionally, such programs challenge harmful norms that perpetuate abuse, such as toxic masculinity, victim blaming, or bullying, creating a more inclusive and understanding environment for all the students. These programs also encourage the establishment of support networks with schools, allowing children who have experienced abuse to access counseling services, legal assistance, or family support resources. I believe legal assistance uh, will be the last thing, and maybe maybe can save the child or we can deal the issue without any legal things. You know, collaborating with parents and communities. It's very important to add your in a team, add parents in your team. As we conduct a parents meeting, we take usually all schools or colleges take permission or give a notice to the parents that the school is going to conduct a adolescence program. Sometimes parents can also join the adolescence program. Sometimes school and college can conduct any parenting program according to the age of child. That your child is of this age, and now these things are very important. So you please be alert about these things. So schools cannot address child abuse prevention in isolations. Programs are most effective when they include collaboration with parents and community organizations such as local child advocacy centers and law enforcement. And in villages, you can include your gram panchayat or panchayat head all this. By engaging parents in the conversations, schools can promote awareness at home and encourage parents to reinforce the prevention messages their children are learning. Addressing the complexity of abuse. It's not very easy for everyone to address the complexity of abuse, especially with parents. Child abuse prevention program help addresses the complexity of abuse that go beyond physical harm. Many forms of abuse, such as emotional abuse or neglect, can be more difficult to identify, but are no less damaging to a child's development. Prevention education often includes topics like emotional regulation, mental health, and resilience building, helping children understand that abuse is not just about physical harm but also encompasses emotional manipulations, neglect, and connivance control. And for this, our teachers should be equipped. You know, teachers have the knowledge and experience also. But many times we find when we conduct a capacity building program for teachers that teachers know that fact, teachers have the knowledge, teachers know the concept, teachers know the literature to handle all these things, but they don't have the practicality. They don't have experience to be practical, and sometimes they don't have that particular type of sensitivity which is required in these some cases. So it's very important for school and colleges to give some capacity building or some awareness program for the teachers so that the teachers can handle the things very in a very good manner, in a safe manner, and very less emotional harm will be there for students, their parents, as well as for the school also. These programs should also consider children who are particularly vulnerable, such as those with disabilities. It's a very painful act when all these things happen with any disabled or mentally challenged child, CWSM. Those in foster care or those who have already experienced trauma, and with the Rift family children also. By customizing prevention approaches for different groups, school can offer a more comprehensive safety net for all the students. So, if you people have some experience, some examples, please share. Have you seen all these type of students? Anytime when you in your classroom you identify the child, how you deal that particular case? Any one of you?
Anybody? Deepa ma'am, Ambujam ma'am, anybody? Adna ma'am.
Uh, Now, what
Yes.
I have seen, in my just next society, uh, what we had observed actually from top, we are seeing there's watchman was showing some prawn videos to the children. And when he was caught, he accepted it, showing all these prawn videos to the children. So, what to do at this time? How to prevent such things?
How to prevent such thing? Which type of case? It was not very clear to me.
It was prawn videos he was showing to small girls. Yeah,
Video.
yeah.
Yeah. Actually, the person who is showing the video, he himself is not knowing. He must maybe he is of school or college.
No, that boy, he was a watchman
Oh no.
and he was showing these prawn videos to girls.
Yes. So here
So,
comes the role of parents as the teachers to
so
teach
we
them.
should punish the watchman or what we should do at this time?
Yes, you should punish the watchman because the issue cannot be repeated again. Definitely, the punishment is there, but before that, what the child has learned with the video, you have come to know, and all the safety measures and what are the harms of these things, it should be conveyed to the children according to their age. According to their age is very important in this matter. If the child is of just 11, 12 years, and especially the girl, and how can you describe all the things, and what can be the effect of the describing all these things? Maybe the child or develop some fear, or maybe the child can be stimulated. Both are harmful. And here comes the role of parents also to teach the children earlier what can be the uh, safety measures, where can you be the unsafe, how to what type of issues should be discussed with the watchman or guard. As I said about the boundaries, don't allow any watchman to enter in your boundaries to share the screen and all this. So these things are important.
What we have observed mostly, sexual abuses comes from the close relatives also sometimes,
Yes, it is
like
very
cousin
painful.
brothers or even your own uncles are also involved in this.
Yes, I have
I've seen
seen
so many cases.
so many students.
What is this?
I know one, even I know one boy who is having some problem related to polio, and it was in Patna. We were there, and the child is average in his studies, having some complex, but school has given so many facilities to him because he is having some difficulty in walking also. After 1, 2, 3 years, he has come to know that his relative is doing some sexual abuse acts with him while sleeping. So as he come to in my office and we discussed, and after repo building he has told me all this. Presently he is MTech from IIT and doing very well, and the stain is removed now. But with relative, it's very painful. Even
Ma'am,
I,
I would like to share something.
Ji, please.
Uh-huh. Now, there was an incident in our school because we were in the habit of, we used to talk to the children. We used to have, of course, an outsider coming and talking to the children because many a times that becomes more effective. And even we used to talk to the children, and we used to talk to the younger children also. It was not of a certain age. We would talk to the uh, pre-primary children also, and we would talk to boys as well as girls because it's not restricted to only girls. It's involved in
Yes.
boys. So we had told the girls, of course, the younger girls, like pre-primary and all, we had told them, see, nobody's supposed to touch you other than your mother. Even your father shouldn't touch you, in an inappropriate way. Or an uncle or anyone. So, as a result, of course, there wasn't anything that had happened. But one day, one of the parents of a pre-primary child came to me and said, "My daughter is crying." I said, "Why? What happened?" She's saying, "Ki, daddy is touching me." So I said, "Daddy is touching means what exactly is it?" So she said, "No, she said, Ki daddy is touching me means he's holding her. Like how a father holds a child and hugs the child, something like that." So then we did mention, we have been having these talks and we have been speaking to you also about it. She said, "Yes, but you know what? My child doesn't know whether that dad is, it's a good touch or a bad touch. It was like, a good touch and a bad touch. So my child doesn't know. I know it is a good touch, but my child doesn't know whether it is a good touch or a bad touch. So how do we go about it when we are telling the children about this? Because rightly what she said is the child doesn't know. A pre-primary child or a first standard child may not know, within the family members. Outsiders, they will come to know. But within the family members, it becomes difficult, for the child to know. So how do we go about it?
I think by saying ki it is very difficult also how to teach a child of 6 years age girl or child to protect himself or herself. How can we teach? How can we train? It is also very difficult. And I would like to share my personal experience, even what I have done with my children. So at the age of class one, in class one or something, around 6 years, so I told them about the contagious and diseases and all this as they had studied in their curriculum. Then there I said ki while going on the street, while in classroom and in playground, don't allow anybody or any stranger to touch you because you don't know what type of diseases he has, and you don't know whether the person has washed his hands or not. From there, I started teaching them how to be safe. It's very
Yeah,
difficult.
yeah,
What
yeah.
what can I say to the
That
children?
is, yeah, when it comes to outsiders, they can understand, ma'am. I'm saying within the family, it is
Uh,
very difficult. How do we
yes,
sort of
yes,
protect
yes.
children
So
in
there,
the
there
family?
we say, ki, but as a with father is a very extreme and rarest case. But where we say ki that father is okay, brother is okay, And we, after 6 years or 7, 8 years, we say that with the children that don't allow anybody to touch your lips, private parts, and the place between your legs or thighs areas, buttocks, like this. Don't
Okay,
allow
okay.
anybody. Why? The children say why? And we, if the child is not asking why, then also we have to explain with logic. Our today's children. There we say because if there any problem with these parts of body happen, how can you show to the doctor? If you have some problem in your open area, then you can show the doctor. If you have some problem or some disease or something in your private parts or like these parts of body, how can you we will show to the doctor? So be safe in this manner. I mean to say, with hygiene, we can try to train or
Yeah,
teach the children of these age, because we cannot go beyond that.
yeah, yeah. That that
So
that
I
really
started
makes sense.
in this manner. And we discussed, we had many experience. We all have many experiences with many type of cases. But I have seen one case. It was in Bhopal, that child abuse over telephone. And the person is uh, very far relative, and the mother was nurse, so the mother has rotational duty. So sometimes it happens in night, sometimes it happens in evening. That particular uncle came to the come to house, and the mother said, "Go and give a glass of water." And the person used to take the glass of water in this way. The girl of class 5 could not understand what is happening with this uncle. And after some times, when she comes to know about this, when she feels uncomfortable, unpleasant, she started reporting to the mother, and mother was in a total in a denial mode. No, it cannot be. No, it cannot be. No, it cannot be. And from class 5 to class 8, and then that particular person used to call him or phone, and used to say some bad words or some name of the body parts and all this. And when I was in school, teachers come to know through the downfall of academic performance or with the change of behavior. Teachers can very much can identify the child. There is something, and the case was like this. In class 8, she was in class 8, and mother was called. Mother was in a denial mode. No, it cannot be happened. The child is not understanding. She is not focusing about studies and all this. After 2, 3 meetings, and the father has started weeping that my little girl was facing so much, and we were totally unaware. So these type of cases, and lots of cases. So it's very important for us to be alert and to be educated or trained to identify. The identification from our side is the first step, and acceptance is the first step from parents' side. And many times it happens, and we act fully, and we save the child. As I discussed the example earlier, a child is in IIT, enter from IIT and doing well. So many, and sometimes we think, it cannot be happened with this child, it cannot be happened with this age of child, it cannot be happened with this type of sex, but it happens with the teen. Even boy to girl to girl, younger to elder, elder to younger, all this. Not with the students locally, with from the teachers, from the non-teaching staff, from drivers and all this. So it's very, whenever I discuss all these things, I feel some pain here, because I have seen so many students, so many parents also. So I have, what should I say? So should I discuss about the physical harm or
Yes,
continuous?
yes.
Okay. So many things are there regarding physical harm or physical problems. So this was the definition we discussed. Okay. Child means any person below 18 years of age, includes all children, all students, regardless any gender. Types of sexual offenses: sexual harassment, sexually colored remarks, inappropriate verbal, physical, or visual conduct showing pornography to a child, sexual assault, touch based offenses, unwanted physical contact with sexual intent, preventive sexual assault, which involves penetration of vagina, anus, mouth, or urethra, can involve penis, object, or other body part, and then sexual exploitation using a child for pornography or sexual gratification includes trafficking, grooming, or online abuse. Right? These type of assaults and abuses are there, and aggravated sexual offenses are there also. And one thing more, which is related to the not for the children, I mean student, which is related to the teaching staff and non-teaching staff, that is posh. Posh is also there. So they also suffered with their working places. That is another topic. But aggravated sexual offenses occurs when the offense is committed by a person in the authority on a disabled child in custody, trust, or institutional care. If the act causes serious injury, pregnancy, or HIV STDs, and during communal violence or natural disasters. You know, human mind is very dirty sometimes. So immediate physical effects, what can be the some minor worries, cuts, broken bones, hemorrhage, or even death. You know, the a child is being used and thrown. So injuries. In some cases, physical effects are temporary, the pain and the suffering, or rib fracture, a shaken baby syndrome, abuse, and all this. It depends upon the age and the physical health of the child also, or the force or the way of ill treatment also. Damages results in intercranial hypertension, increased pressure in the skull after bleeding, in the brain, damage of spinal cord or neck or rib cage bone or fracture. Fractures, cuts are very important, very common. Impaired brain development, because it gives an stain here. So when the stain is there, it reacts like in brain development also. Child abuse and neglect have shown in some cases to cause important regions to the brain to fail the form of grow properly, resulting in impaired development. Or there may be some psychological or brain development disorders also. Long-term consequences for cognitive, language, and academic disabilities. Poor physical health, in addition to possible immediate adverse physical effect, household dysfunction, and childhood maltreatment are strongly associated with many chronic physical and psychological effects, including subsequent ill health in childhood, adolescence, and adulthood, with higher rate of chronic conditions, higher risk of health behaviors, and shortened lifespan also. In some cases, you find physical ailments such as allergies, arthritis, asthma, bronchitis, high blood pressure, and ulcers also. There may be higher risk of developing cancer later in life, as well as possible immune dysfunction. Immune system is also affected badly. Exposure of violence during childhood is associated with shortened telomeres and traumas, even insomnia also. Neurobiochemical changes. Physiological mechanism can moderate how severe illness became a patient with a past experience with violence or abuse. And psychological violence, emotional abuse, or mental abuse is also a form of abuse, characterized by the person subjecting or exposing another person to behavior that may result in a psychological trauma, including anxiety, chronic depression, and PTSD, post traumatic stress disorder. It is associated with the situation of power imbalance in abusive relationships, including bullying, gaslighting, and abuse in workplace. Effects of child sexual abuse on the victims include guilt, self blame, flashbacks, nightmares, insomnia, fear of things associated with abuse, the particular surrounding, the particular type of person, the particular date, time, smell, places, doctor's visit, self esteem difficulties, sexual life functions, chronic pain, addiction, self-injury, suicidal and identification, somatic complaints. Somatic complaints are very common. Depression, PTSD, anxiety, and other mental illnesses, including borderline personality disorder, as I said earlier also, dissociative identity disorder, remicrodization in adulthood, and bulimia nervosa, and physical injury to the child, among the other problems. Children who are victims are also increase the risks of STD. And especially for the 11th, 12th student, there is a program to teach about the STD also. And sometimes we have to teach about these things to the teachers also. And STD infections due to the immature immune system and high potential for muscular tears during forced sexual contact. Increased prevalence of HIV, engagement in high risky sexual practices, condom avoidance, lower knowledge of safe sex practices, frequent changing in the sexual partners, and more year of sexual activities. Guilt, which is a cognitive and emotional experiences, because many victims feel that there is some problem in me, why it happened to me with you, and sometimes the parents or other people say you have done something wrong, so it develops a guilt. Moral standards and bear significant responsibility for the violation. Guilt is closely related to the concept of remorse. Blame. Blame is act of censoring. Moral responsibility, praiseworthy, all these things are related to the blame. One may praise someone's good dress sense and blame their own sense of style for their own dress sense. You know, by blame in a positive way, in a negative way. Flashback or involuntary recurrent memory is a psychological phenomenon in which an individual has sudden, usually powerful re-experiencing of a past experience or element of a past experience. Their experiences can be happy, sad, exciting, or any other emotions one can consider. The term is used particularly when the memory is recalled involuntary or when it is so intense that a person relieves the experience unable to fully recognize its memory and not something that is happening in real time. So just remembering all those traumas, the child become or the person become ill also. Nightmare, or you can say bad dream, particular type of fear or anxiety, sadness, sleeplessness, distress state, and fever also. Nightmares can have physical causes such as sleeping in an uncomfortable position or having a fever, or psychological cause such as stress or anxiety. Insomnia or sleeplessness, it is a sleeping disorder, and it can be happen with these type of victims. Depressed mood, low energy, irritability, all these happen with these type of victims or the sufferers, you can say. Yes, definitely self-esteem reflects, it's very important self-esteem, that self-esteem reflects an individual's overall subjective emotional evaluation of his or her own worth. It is decision made by individual as an attitude towards the self. Self-esteem encompasses beliefs about oneself. Then the person or the sufferer self-esteem became very low. And psychologists regard self-esteem as an enduring personality characteristic. Self-esteem includes many things: self-worth, self-regard, self-respect, and self-integrity. Sexual malfunction or sexual disorder is difficulty experienced by an individual or couple during any stage of normal sexuality. In later age also reflects in a very bad shape, which come under some illness also. So, at the appropriate age, the person may feel also some malfunctions or malactivities, and assessing performance, anxiety, guilt, stress, and worry are integral to the optimal management of sexual dysfunction. Chronic pain. Sometimes it happens some chronic pain, especially in abdominal and in private parts, or neuropathic pains. Chronic pain may originate in the body or in the brain or spinal cord. So it is also seen that many victims have these types of problems. Substance dependency or drug abuse. A drug addiction, a distinct concept from substance dependence, is defined as compulsive, out of control drug when the person is remembering something, or all of a sudden some pain or something happened. So the person or the child used to take some drug to give a temporary relief or to go away from the particular situation for withdrawal also. Self harm, self injury, suicidal intentions, self mutilation, self cut, toxic uses, all these harm the child's health. Suicidal identification. It's very common, and I would like to say that tomorrow is a Suicide Prevention Day, and today we are discussing all this. The range of suicidal ideation varies greatly from fleeting thoughts to extensive thoughts to detailed planning, role playing, or incomplete attempts which may deliberately constructed to complete to be discovered, or may be fully intended to the result in death, but many times not in death, or some having some severe physical injuries or fractures. Major depressive disorders: low mood, low self-esteem, loss of interest, uh, some obsession, some compulsion, some mood disorders, split personalities, and PTSD, mental disorder, sexual abuse or revolt because of sexual abuse or assault or some mal behavior. You know, the person attempts to avoid trauma-related cues, alteration in how the person thinks and feel, and increase in the flight to or flight response. Young children are less likely to show distress, but instead may express their memories through behavior. A person with PTSD at a high risk of suicide and intentional self-harm. Anxiety, though everyone is suffering with anxiety nowadays, but these victims have a high level of anxiety. There is fatigue, overreaction, irritation, rumination, somatic complaints. Yes, psychosomatic disorders are there, psychosomatic illnesses are there because of something happened badly in their childhood. A mental disorder, also called a mental illness or psychiatric disorder, is a behavioral or mental pattern that causes significant distresses or impairment of personal functions. Even with the person who has having the age of more than 20 years, it all happens. It all happens. That particular person is also a sufferer, and I've seen that persons also. Such features may be persistent, relapsing or remitting, or occurs as a single episode. Many disorders have been described with signs or symptoms that are widely between specific disorders diagnosed by a mental health professionals. Borderline personality disorders, emotionally unstable personality disorder, PTSD, or psychosomatic problems, substance abuse, eating disorders also. Eating disorders are very much related to the emotional imbalance. Multiple personality disorders, trouble remembering certain events, borderline personality disorder, post traumatic disorders, as I said earlier, substance misuse also, eating disorders. Eating disorders mean the pattern of eating, the quantity of eating, the timing of eating, sometimes very low, sometimes very high, all it comes eating disorder. Eating disorder you can describe according to the age. Similarly, abusive head trauma, shaken baby syndrome, the seizures, visual impairment, cerebral palsy, cognitive impairment, and fits also. So, there is a long list of physical harm, injuries, and even deaths also. And there is a very long list or the symptom of related to the psychological development or trauma, and sometimes people cannot come to know what type of psychological problems the person is facing actually. So what we have to say, we have to save our children first. So what teachers can do, teachers should be sensitive to the needs of children and should create an environment where children feel safe to disclose any form of abuse. Teachers should also be alert to any change in child's behavior or appearance that could indicate abuse. In case a child discloses abuse, teachers should immediately report the matter to the concerned authorities in a very sensitive manner. What can the schools do? Every school, according to the POCSOAct, should have a school complaint committee. Anyone who witnesses or suspects child sexual abuse or who learns of an incident from children should report it to the committee. The schools should also install a complaint or suggestion box in the school for the students to submit written complaints. The committee should act immediately or any child sexual abuse complaint received through the complaint box or otherwise. The school should appoint a part-time or full-time counselor, which many schools are missing. They should inform the children about the service availability and encourage interaction between the counselor and the students. You see, we counselors just identify in 5-10 minutes with the child that what is happening with the child. Even parents could not understand, could not recognize. So take protective measures to prevent child sexual abuse, like CCTV camera, warning signs, monitor to activities the staff members, visitors and strangers, even with the ayahs and class 4 employees. Always keep an eye on who the children are living with, in bus, in conductor, with driver, and all any person. Monitor any activity that involves photography children, using photographs of children, using the internet or using technology on school grounds. Nowadays, our adolescents are very smart. Even we cannot catch their knowledge of technology and use and misuse of all these things. So background checks of faculty before they are hired to ensure there are no previous record of sexual abuse or as an offender. So salient feature of POCSO Act. POCSO Act is child friendly. Child is given police protection during the investigating procedure, can avail emergency medical treatment, provisions for avoiding re-victimization of the child, special court to decide compensation for the child, can testify through video link, and CSA case should be disposed within 1 year of reporting. Highlights of POCSO, but this is important. When we, if we are not that much of sensitive understanding, if we are not empathizing with the issues, what can we do? And you know our judicial system also. I have nobody to say about this, but just feel and be empathetic. Thank you.
Yes. Deepa ma'am, would you like to?
Yes, yes, ma'am. Yes, ma'am. I'm very much there. I would just like to thank
Yes.
Dr. Kumud because you have highlighted practically what is really required for schools, what is required for the teachers to know, you know, what they have to do, and they should be alert. Their eyes and ears should always be open. And very rightly said, you have to be empathetic. You
Yes.
have to, and only then something can be done.
Yes.
The act itself is a very important act, and one, as educators, I feel it is very important for us to understand that and make sure that we be alert and take care, and also keep the parents posted about it.
Yes.
Many a times parents are not aware, so keep the parents also posted about it.
Yeah.
Thank you, ma'am. Wonderful, wonderful session, I must say. So much of information you have given. Wonderful.
Mm, yes. Anbujam ma'am, would you like to say something? Please,
Sometimes I was not
please
very
ask.
clear while speaking, I feel, because while reading the slide, suddenly some case comes to my mind, and I feel, I feel some, I don't know what can I say. I become emotional. So it may be that sometimes I was not very much clear while speaking to you all.
No, no. No, no.
We
It
can
was clear.
we can understand that, ma'am. We can understand
Yes.
because it is dealing with, you may have come across many students.
Many, seriously
Yes,
many.
and therefore I can truly understand what you must be going through, and those things must be just coming in front of your eyes. So I can understand.
Thank
So
you.
your profession itself, I know that teachers, we talk about teachers, very this, but your profession is an exhaustive profession for the mind.
Yeah.
And hats off to you, hats off to you.
Mm.
Wonderful, wonderful work that you are doing. Hats off to you.
Yeah.
Yeah,
Anbujam ma'am.
yeah. You know what? Today I've been more a listener, and I appreciated the session because she has crowded 60 slides in 1 hour. It's an enormous feat and such a lot of information.
Yes.
For us, yeah, to absorb, it's going to take time. Wonderful session, ma'am. You know, you have given us a lot of food for thought.
Yeah. Thank you, ma'am. Anybody else would like to share, Sadhana, ma'am? Would you like to share? 𝐂𝐡𝐢𝐥𝐝, ma'am, Sarabjit, ma'am. Please.
No, actually, really, it was wonderful session today that we had, and we were not so much aware about POCSO. So today we
Yes.
came to know so many things about it. So I must thank her for such an informative session today.
Yeah.
Actually,
Okay.
2 months back, we conducted a workshop for teachers and for staffs also about the POCSO and POSH. So there I took a 2 hour session with teachers, and 1 hour session was taken with by an advocate.
Oh, that's nice.
We have done it in an army public school.
Okay. That's nice.
Sarabjit, you want to say anything? As Ambuja ma'am said, everybody's trying to absorb
Yeah.
this. I remember Sarabjit, the school that she's working in, I was earlier with that school. And
Yes, yes.
when this act came into, in being, we had, of course, counselors. Have always been making sure that we have full-time counselors with us, so, and special educator. So the our counselor did a session for the parents, and told them what it is, what all they can do under this act, so they should be, familiar with the act. And then we had sessions for the uh, children also. We spoke to them. Of course, we didn't tell the what
Yes.
all it is, but as I told you, little bit what we can tell the children, what they are supposed to do, they are not supposed to do. Plus the teachers, we had it for the teachers also at that time. But yes, it was so many years ago, and now with your session, it's sort of a revival. I am getting back all that was spoken at that time. So it was really very good.
Ma'am, we had it last year also, and we keep having such sessions, but what ma'am shared here, there during that time we had called parents, and we updated the parents also that all this is there, and they had also started with videos and stuff. But what ma'am told us here is also, I mean, there was such knowledge, such, a bag full of knowledge, I can say. Thank you so much, ma'am. Yes, it was amazing. The session was amazing.
My
Okay.
pleasure.
So, Deepa ma'am, so I think we can wind up.
I think, unless Suresh sir wants to say something.
I don't know.
Ma'am,
Good evening.
I'm sorry, I could not attend fully. I just, in the end only, I have joined. I was traveling. I have just come home. So I'm sorry. Since last 5 minutes I heard, whatever remarks I heard, it was fantastic. Thank you very much for joining CRDE. We expect further future programs from you, ma'am.
Anytime.
Okay.
You can wind up, ma'am.
Okay. Of course, at the outset, let me sincerely thank today's speaker, Dr. 𝐂𝐡𝐢𝐥𝐝 Srivastawa, for a very informative session in depth, so that it is easy for all the educators to go ahead with different stakeholders, the POCSO Act to be taken, which will help at a larger session. Thank you so much. And thank you to all the educators present here. Ambuja ma'am, Sadhana ma'am.
Thank you.
Thank you.
Yeah, Saroj ma'am was also there. Sarabjit ma'am, 𝐂𝐡𝐢𝐥𝐝 ma'am. And last but not the least, I sincerely thank Dr. Suresh Nair and Deepa Desai ma'am, for giving me this opportunity to host the webinar. Thank you so much.